One of the most important things about recognizing eating disorders is the sooner they can be recognized and the sooner they can be involved in some sort of a treatment, the better the outcome is. The longer people go untreated, the longer people go unrecognized, the more ingrained and the more severe an eating disorder can be, the more difficult it can be to treat. We, in our service, really aim for seeing people within 3 years of developing their disorder. So sometimes the signs early on can be quite subtle, but anytime people are picked up with an eating disorder, they should be directed to help, should be directed to try and get treatment and to not leave it for an excessive amount of time, because early intervention really is key to rapidly kind of addressing the underlying problems and treating it before it becomes too severe and too ingrained. The things that people, family members or people in themselves could be looking out for, one of the most obvious is probably kind of physical changes. So if someone's weight is going up or down very quickly or kind of fluctuating over a time period that is really clearly observable, that would be something that is pretty kind of conspicuous. Also, behaviors around food can be quite noticeable. Sometimes it can be very, very noticeable behaviors like taking extremely long time to eat food, very small portions on plates, engaging in kind of abnormal rituals like cutting up food into very small pieces or tearing things up or spending a long time pushing it around on the plate. So kind of directly observable eating behaviors is another one. There can be other signs that are maybe more difficult to spot, and they would be, like, for example, just social withdrawal, not being kind of that present, neglecting friendships, neglecting family members, especially around food-related behaviors. So, family meal times, taking the meal to their bedroom. If they'll meet their friends for a night out, but their friends might be meeting for dinner beforehand and they won't join for the dinner part. So kind of the social behaviors is something really noticeable. Often people with eating disorders, really kind of significant parts of their life can be neglected, but they can focus quite clearly on certain things. So we see a lot of students in our service because we're located next to large universities, but also that's the common demographic of people that tend to experience eating disorders. And we'll see them and they won't be able to see their family, they won't be seeing their friends, they will have dropped out of work, but they'll still be doing very well in college. And that's the way that it can sometimes happen, that gradually parts of the life can be kind of dropped off, because people just don't have the capacity to engage with the kind of the full amount of life that they had going before the eating disorder, until they're left with kind of one thing, and then often they can use that one thing to say, well, I'm doing just fine because I just passed all my exams, and really just the bigger picture is actually there's been a significant change. Other things that are quite common are developing new or kind of exacerbation of previous other mental illnesses. So people who sort of develop problems with their mood, develop problems with anxiety, those sorts of things would be very common in people with eating disorders. There's lots of comorbid mental illnesses. Another one would be kind of becoming quite obsessional about things, very kind of rigid and kind of preoccupied with order and doing things in a certain way. So those sorts of things would be kind of red flags as well for early signs of people experiencing an eating disorder. Also, physical effects is quite significant. So it can really present in a number of different ways. Sometimes people will get picked up because they have problems with their teeth. They can develop cavities or kind of other problems that their dentist might notice. Sometimes people might have a blood test that shows that they have problems with their red cells, that they become anemic, or they have problems with their white cells, that their immune system is not functioning very well, or that there's problem with their electrolytes, which can really kind of be quite severe and quite serious, that people can collapse, they can have seizures, they can have problems with their hearts, whether that be a kind of a progressive wear and tear on the heart leading to heart failure, or they can have something quite sudden happen, that they can develop a sudden irregular rhythm and actually have a heart attack. So there's lots of physical problems, and then there's also lots of serious but less urgent physical problems that sometimes people start to experience, and they might pursue gastroenterology for problems with their bowel, but actually it's related to their eating. They might have a fracture from overexercise, or a fracture not even necessarily from overexercise, just from being, having fragile bones. And that might be the first sign that someone might have with that they developed an eating disorder. And one of the more common physical signs that we see in our service is that there'd be young women who should be menstruating normally have noticed a change in their menstruation, whether that's become irregular or it's become very light or it's actually stopped altogether. And then both males and females, problems with their libido, so just really kind of loss of healthy sexual appetite, that can be another early sign. So there's kind of a wide range of different signs. Not all of them are going to be present, and there may be only one or two, and it can affect different people in different ways. But I'll go back to the first point, which is that recognizing early, identifying kind of how people can access treatment and then engaging with treatment early is the number one thing to do for people who have an eating disorder. So the level of insight people have into their illnesses, so that's how much understanding they have of what their problems are and how serious they are, can really vary significantly from person to person and from diagnosis to diagnosis. In eating disorders especially, it can be really kind of difficult to kind of identify, because people have developed an eating disorder really as a coping mechanism for things that they weren't able to cope with otherwise. So ultimately the eating disorder is something that serves a very important function for someone in their life, and often coming forward and looking for treatment, there's a number of fears, one of which being, if I lose this coping mechanism, what do I have left? And feeling that at that point they actually really would not be able to cope with their life at all if they didn't have the eating disorder or the relief the eating disorder gives as some sort of a fallback for them. So first of all, they can be very concerned about looking for help because they're worried about what will happen if they get help. There's also a worry about not being sick enough, which really is very prominent amongst eating disorders, that they might feel terrible, they might be able to point to really significant problems in their life, but actually feel like a little bit of a fraud in seeking treatment, and worried that if they talk about their problems, they'll be told they're silly, they'll be told that their problem isn't serious enough to receive treatment. And that's, the word describes that, it's stigma, and it's something that people can stigmatize themselves, but also there is a wider stigma in society that people either may have experienced going to their GP or discussing with someone in their lives that they've brought this up as an issue and been told that it's not that serious, and they can become very afraid to bring it up again. And I guess also there is a significant lack of services in Ireland. So there can be lots of media reports about the lack of services, the lack of inpatient treatment, new teams not being available in certain areas, and that in and of itself can be prohibitive, that people are worried that there isn't a service available. They're aware that something is not in existence, and even if it is in existence, it's very scarce, so they would feel in some way that they're not deserving of it, or that they're not serious enough to look for it. So although people may sometimes have a good idea that they're having significant problems, there's a number of barriers to actually accessing treatment, which I suppose the National Clinical Programme is really working hard to try and break those down by putting more teams into more areas. Bodywise are trying to raise more awareness about eating disorders and about how people should get help, and they've produced specific guides on how to access treatment, what pathways to do, really step by step for people to understand, and also a step by step guide for families as well, so that they can understand what is the most reasonable way to try and support someone into treatment, even when there are these barriers, whether they be personal or systemic, to accessing treatment. So eating disorders are very complicated. There is no simple cause and there's no simple explanation. The way we usually think about it is that there's a number of different types of risk factors that people can be exposed to during their life, and if they reach a certain threshold, or if you have a certain triggering event, you can develop an eating disorder, and that can be quite unpredictable, that some people may experience one or two risk factors and develop a very serious eating disorder. Someone may experience a number of risk factors and have no issues at all with food, and so it is extremely unpredictable. What we know is that there are certain associated factors, and we can maybe talk about those. There's a definite genetic linkage, so eating disorders do run in families. So again, it doesn't mean that if you have a relative with an eating disorder, you're also going to develop one, but it does mean that you are at increased risk. There are specific kind of socio-cultural risk factors as well. So this is the general social cultural pressure with an idealization of thinness, and that can be anything from magazines, film, TV, to your own peer group, and then obviously what we're contending with in the last decade or so is the amplification of those social pressures through social media, which is something that really, it's happening in real time, so we don't really have any research evidence to back up how exactly severe the social pressures are, but certainly we've seen at the time that there's a rise in social media, we've seen a rise of eating disorder presentations, so certainly they are in some way correlated. There's also psychological factors as well, so certain personality types are more vulnerable to eating disorders, specifically people with what's called a negative affect. So this is people that are prone to sort of being quite depressive, quite anxious, or in other ways having a low self-esteem. There's also people with quite obsessional personalities, people with, I guess, fitting into that perfectionistic personalities, and people who also have problems with maybe impulse control, problems with emotional instability, sometimes called borderline personality if people have kind of gotten as far as having that diagnosis, or else called borderline traits, as in having those sorts of features but maybe not to the extreme level of having a full-blown diagnosis. There's also other psychological factors that people can experience over the course of their life, so people who've experienced trauma, especially childhood trauma, people who experience, in some way abnormal eating or food behaviors in their house growing up, whether that be people who experience kind of food poverty, or people who grow up in a house where dieting, exercise, lots of concerns about body image, or other kind of irregular eating behaviors, or actually witnessing an eating disorder in your family home would be other significant risk factors. And then finally there's physiological ones, some of which are relatively well understood and some of which are less well understood. The well understood ones are really the effects of starvation. So when you're starved, your brain spends a lot more time thinking about food, your body goes into sort of survival fight or flight mode, and you develop a lot of the sorts of features of an eating disorder that just kind of happen naturally as part of starvation. This is something that can be kind of a specific trigger for people, that people, especially adolescents, going on to very kind of extreme diets, that they can be a trigger for people developing an eating disorder. So definitely dieting behavior is something that can actually activate an eating disorder in someone who has those underlying vulnerabilities as well.